Now, human retroviruses, they encode reverse transcriptase enzyme, and it reverses normal transcription. Instead of DNA to RNA, we're going to have a single strand RNA make a double strand DNA. And these viral genes get permanently integrated into the host DNA. And so the HIV retrovirus is what causes AIDS, acquired immunodeficiency syndrome. And this first emerged in the 1980s. Severe pneumonia caused by Pneumocystis jirovecii, which is normally harmless, was involved, and there's a rare form of vascular cancer that's called Kaposi's sarcoma, with sudden weight loss and swollen lymph nodes, and immune function basically ceases. The first documented case was in 1959. There's HIV-1 and HIV-2. There are T-cell lymphotropic viruses 1 and 2 that cause leukemia and lymphoma. But HIV can only infect cells that have the required CD4 receptor on the white blood cell plus a co-receptor. That's the only ones they can infect. Transmission is mainly sexual intercourse or transfer of blood or blood products, but babies can be infected during birth or from being breastfed. HIV doesn't survive long outside of the body. As far as infection, nationally it became really talked about and noted in 1984. It's the 6th most common cause of death among people that are 25 to 44 in the United States, and men account for 75% of new infections. Carriers can be IV drug abusers, so it also spreads to the heterosexual population. And in 2009, they estimated that we have around 1.2 million in the United States that are infected, and worldwide that's 35 million people that are infected. The way it enters is through the mucous membrane or the skin, and it goes to the dendritic phagocytes that are beneath the epithelium, and it multiplies and it gets shed, and it's taken up by macrophages in the skin and the lymph organs and the bone marrow and the blood. And then it attaches to that CD4 marker and co-receptor and fuses with the cell membrane. So the reverse transcriptase enzyme we mentioned a while ago will make a copy, a DNA copy from that single-stranded RNA. And then that DNA, that copied DNA, the viral DNA, is integrated into the chromosome of the host. And you can have a lytic infection or it can stay latent up to 11 years. The symptoms are related to how much virus is in your blood and the level of your T cells. When you're initially infected, you may have mono-like symptoms that don't last very long, and then you're asymptomatic most often for around 10 years. And then when the T cell levels fall below 200 per milliliter, that's when you have AIDS and the immune system is destroyed. Fever, swollen lymph nodes, diarrhea, weight loss, neurological symptoms, opportunistic infections, and cancers are seen here. To diagnose it, you look for the antibodies in the serum or other body fluids, and it's done at 2 levels. The initial screening is done, and it's pretty rapid, but often you get false positives. But then they use this Western blot analysis to rule out those false positives. Now, false negatives also can occur. So if you've been exposed, you need to be tested a second time 3 to 6 months later, or if you suspect you've been exposed. There's no vaccine. The best treatment or prevention is monogamous sexual relationships, condoms, and universal precautions. There is no cure. but they can use therapies to slow it down or diminish the symptoms. They can use inhibit viral enzymes, RT, protease, and integrase. They can try to inhibit fusion and inhibit the viral integration, but the highly active antiretroviral therapy is the most effective treatment for it. Now, the human T-cell lymphotropic viruses, leukemia is one, and it's a malignant disease of the white blood cells. The white blood cell forming elements that are in your bone marrow, and they're all acquired, they're not inherited. Some forms are acute, others are chronic. Usually the first signs is easy bruising, bleeding, paleness, fatigue, and recurring minor infections. But underlying pathologies include anemia, platelet deficiency, and your immune system dysfunction because you've disturbed the lymphocyte ratio and function. The human T-cell lymphotropic virus 1 is called adult T-cell leukemia, and it often presents with cutaneous T-cell lymphoma, where the dermatitis, you get dermatitis and the skin is thick and scaly and ulcerative, and you have a lot of tumorous skin lesions. Which of the following are current therapies for HIV infection? And of course the answer is all.